Hello guys, Dr. Emmanuel here, and I'm back with another video on Plab 2. Today we'll be talking about history taking in Plab 2. I hope you're going to learn something. Thank you. So let us begin history taking in Plab 2. Today we are having a scenario. The scenario says you are an FY2 in accident and emergency. Who the patient is? The patient is Mrs. Victoria Yates, 32 years old. Has come with some concerns. Kindly talk to her and address her concerns. Additional information, none. Now remember, this type of scenario or this scenario, you will be given the scenario outside the cubicle. You will have 1.5 minutes to read the scenario, and then once you enter the room, you will have 8 minutes to clerk the patient and come up with a diagnosis and manage the patient. Now, while you're outside the cubicle, what are you going to be looking at? Look at the scenario, look at the setting, accident and emergency. What are other types of settings that you can have? You can have GP surgery, you can have outpatient, you can have inpatient. Remember. So, have in mind that you are in the accident and emergency. The importance is that once you are in the accident and emergency, you understand that the patient might be having a condition that requires quick intervention. The patient might be in severe pain, the patient might be bleeding, the patient might be having a convulsion, or the patient might be having any issue that involves urgent intervention. Number 2, look at the name of the patient, Mrs. Victoria Yates. Remember, it is good always to know the name of the patient. It will give you marks for interpersonal skills if you know the name of the patients. But if you forget the name of the patients, you are going to lose marks because that means you are not concentrating. Also, finally, look at the age of the patient while you're outside the cubicle, 32 years old, and always remember the age of the patient. This one also will inform you that the condition that the patient is going to have has to do with a condition that is not geriatric. So, for example, this is not a patient you are expecting that they are going to have maybe osteoarthritis or maybe conditions related to menopause. You expect that they are going to be having some acute conditions, probably a miscarriage, probably they are going to have PID, or probably they are going to be having something acute that is related to a young patient. Now, what do you do once you enter the room? So we are going inside the cubicle. Number 1, you are going to introduce yourself. Now remember, always when you enter the room, you should be smiling. Unless you are going to break bad news, always enter the room while you're smiling. Now introduce yourself and say, "Hello, my name is Dr. Alusiola Emmanuel. I am one of the junior doctors working in this accident and emergency department." That is how you introduce yourself. So you greet, always greet. Greetings. Hello. Introduce yourself, name. So naturally they say it is better to say, "I am Dr. Alusiola Emmanuel." Remember, I am using my surname first after my title. I am not saying I am Dr. Emmanuel. I'm saying I am Dr. Alusiola. So because according to the British culture, they like to use their surname after the title. So you say, "Hello, I am Dr. Alusiola Emmanuel. I am one of the junior doctors working in this department." Kindly remember that you are always a junior doctor. So once you say hello, kindly wait for the patient to respond to the greeting. Don't be in a hurry. Don't say, "Hello, my name is Dr." No, hello. Wait for the patient to say hi or hello, and then say, "My name is Dr. Alusiola Emmanuel. I'm one of the junior doctors working in this accident and emergency department." Now you've said your name. Ask their name. It is better if you have forgotten their name, say, "May I know your name, please?" May I know your name, please? They say, "I am Victoria Yates." So they will tell you their name. Then be nice and say, nice to meet you, Victoria. Now, if the patient tells you two names, Victoria, Yates, it is important to ask, how would you like me to call you? Or how would you like me to call you? Don't say, how would you like me to refer to you? How would you like me to call you? They will say, okay, you can call me Victoria. Then you can say, nice to meet you, Victoria. And then wait. They'll say, nice to meet you too, doctor. Remember, Plab 2 is only assessing your communication skills, whether you are a safe doctor, and a little bit of your management skills. So introduction, we've said, and then saying your name, waiting for the patient to say their name, and then confirm the age if you've forgotten. Say, may I confirm your age, please? So age, they'll tell you, I'm 32 years old. Okay, so before you start your introduction, before you start your consultation, tell the patient what brings you to your clinic today. You can say that. What brings you to our clinic today? Or you can say, how may I help you? How may I help you today? Then they are going to tell you, oh, doctor, I have abdominal pain. I have pain. I have pain in my tummy. Yes. So that is the first part of the introduction. Remember, introduction is very, very important. How you start your station determines whether you are going to pass the station or you are going to fail. So in summary, what have you said? Introduce yourself. Enter the room while smiling. Greet the patient. Hello. Give them time to respond. Hello. My name is Dr. Alusiola Emmanuel. I am one of the junior doctors working in this accident and emergency. You can either say, are you Victoria Yates? Or if you have forgotten the name, you can say, may I confirm your name, please? They will tell you, I am Victoria Yates. Ask the patient, how would you like me to refer to you? They say, okay, you can call me Victoria. Nice to meet you, Victoria. They will tell you, nice to meet you too, doctor. May I confirm your age, please? I am 32 years old, doctor. Okay, thank you. Victoria, what brings you to our clinic today? Or how may I help you today? So this is the first part of our history taking. We will be looking at the second part where we'll be dealing with the history of present.